First, you back doctors who are threatening a 5-day walkout from tomorrow. This has crept up on us, hasn't it? 020 7862 2222 is the number. Resident doctors, used to be known as junior doctors, are set to strike tomorrow after negotiation talks with the government broke down. The Health Secretary has compared them to a cartel and said he's already given resident doctors a 28.9% pay rise, and the country can't afford to pay any more. Let's just have a look at their pay scale, as it were, what they can expect to earn during and after training. So for a 40-hour week, a resident doctor in basically year one, this is how we start the whole process, is paid currently $38,831. According to FullFact, the BMA want this to go up to $47,308, which they say, the BMA say, would be a restoration for the last 20 years of their pay falling behind. You then have the doctors year 2, years 3 to 5, 6 to 8, and so they end up speciality registrar in the 6th, 7th and 8th year. Currently on that, nearly 74,000. The BMA said really, to make up for the last 20 years, it should be 91,000. And they told us they want to reach a deal on both pay and jobs that delivers for doctors and patients. But the government seems intent on preventing it. What do you think?
Good. They should prevent it, because these doctors should not be taking any strike action tomorrow at all. They're putting patients, patient care, the families of the patients at grave risk. Grave risk of death. They're not getting the surgeries. The elective surgeries will need to be cancelled. And thank God, doff cap to Professor Dr. Mackay, who actually wrote to the NHS trusts and hospitals to say, you need to keep an eye on your budgets over this weekend and these 5-day strikes, but also your patient management. And do not let patients fall off the cliff from this. Talking to people, either through social media, my friendship groups, my family, I don't know one supporter of these strikes.
Looking at the politics of it, Kevin, it doesn't make sense, because even Labour doesn't want it.
Yeah, look, I wish they weren't striking. I don't want them to strike, but I'm not going to grab a pitchfork and light a torch and march on A&E or hospitals and begin denouncing them.
Clare.
We rely on them, and they feel they've got a grievance. And I disagree with politicians who say they should be banned from striking. I think that's a basic right in any democracy. But they feel they've got a grievance that hasn't been addressed. And in any dispute, and I've covered the world of work for decades, there's always right and wrong on both sides. And how do you get them back together, two sides?
This is different, because somewhere an old lady who's had a hip pain for 2 years will have waited for an operation next Tuesday, and it will be cancelled, and she'll have another 2 years to wait. And that's the problem here. It's not like other strikes.
But it's almost then just saying all those cancellations and all those waits are just on the doctors striking, when in fact it's not. It's been on chronic underfunding of the NHS and not having enough doctors, that those lists have all built up.
Claire.
So why do we laser-like focus now just on these doctors rather than the wider, more fundamental problems that create the problem in the first place?
It adds to the problem, and it is the problem.
It's not the problem.
That's a basic salary. When they come off their overtime, they work. They could actually come home with double that. Okay,
if you do overtime.
Junior doctors do a lot of overtime, Kevin. And do you know how much it's going to cost a hospital trust to bring in a consultant for on-call care for a weekend? £6,000.
There we are. It'd be better to pay them more, then they won't be on strike. Pay them more, and they won't be on strike, and you'll save that.
I'm just going to, on that point, Kevin, this is the fundamental flaw, isn't it? Because the government thought that, and they went in with their 29%, and they thought, we've done it.
Yeah.
And you know what? They came back for more. And when you pay them more, they strike again. That's the formula.
No, because it's all about pay restoration to 2008. Wages have been through a terrible squeeze. Not just doctors. I understand why other groups of workers complain too. We've seen the decline in living standards. Yeah. But they haven't addressed the longer-term problem, how you go back to 2008 in the terms of the value of your pay.
In the private sector, you can't go back now because we're all being paid less.
Wages are rising faster in the private sector than they are in the public sector overall. But you can see if doctors have got a grievance, they're gonna pursue it.
And in the end, look at this the other way around, Claire. They've got the leverage to do this. They can double their pay if they want to.
That's what I was
They've got the leverage. They can win.
But that was the other optic I was going to mention here, because it's very unfair. They're charging this at the number of doctors that are leaving to go to Australia, America, the United Arab Emirates, where they're paid a lot more money and the perceived lifestyle, the life-work balance is much better. No one's denying that. However, it's the NHS and the universities here that have prepared them, that they've studied here.
Well,
they should be giving back.
We steal a lot of doctors from poor.
They should be giving back.
Yeah, okay, that's interesting.
Hang on, they've got high tuition fees. They've run it up. Come on.
Julie in Somerset, hi. Are you sympathetic with the doctors here, Julie?
Yes, I am. I'm a registered general nurse and a state-certified midwife myself. You have to work jolly hard, especially if you want to just about make a living. And I have every sympathy for you and them, the doctors. The lady on the left-hand side, please, you're not a nurse, you're not a doctor, you don't know what you're talking about.
Well, she's a taxpayer.
We had to sit,
and
hold on.
A patient.
Yeah, good for you, well done. We had to sit and watch the Conservative government, which is where this problem comes from, run the NHS into the ground. And if the Conservatives had got in again, we wouldn't have an NHS. At all.
Claire
will
respond.
This problem comes from.
Go on, Claire.
But we're not going to have an NHS anyway. It's not. It used to be the paradigm of virtue. Everyone used to look at the NHS as some cow religiously, and it's not that. It can't be that. It's on its knees. There has to be institutional change. And Wes Streeting is coming in, and he wants to move the pen pushers out of the way. And doctors, junior doctors at the moment, are very self-entitled, and they shouldn't be. They should be reading the room, and they should be saying, "Look, the public purse is already bulging. We have got a budget coming up in 2 weeks' time. What on earth is Rachel Reeves going to do? She can't solve the NHS. She can't solve the political optic of this country at the moment. And she certainly shouldn't be giving any more money to the health service in terms of payment increases to junior doctors.
Do you think if the doctors get this rise, they'll stop striking, Julie?
I would like to think so, yes. But like I'm going to say again, please, you're not a doctor, you're not a nurse.
Well, you
don't know how hard we have to work to get those qualifications.
Yeah, but she's a taxpayer.
That's the fact. You want to find the money from somewhere? Stop the boats. How much is that costing us? That money should go into the NHS.
Boats. All right, I've got you. We go straight to the boats on so many stories. It's amazing. I don't think that would necessarily do it, but you would. 6 million a day on hotels was the last time I looked. Okay, Julie, thank you. Caroline in Essex, hi.
Good morning.
Are you sympathetic with the doctors striking?
No, they get paid extremely well for what they do. Most of them, if they're junior doctors or what they now call them residents, which I think is an insult to the residents, is the fact that they are learning and they have got to learn. And for that, you have to put in the time. No, their benefits are so high and they're gilt-edged. If anybody else in the society gets it, they would be flying to the moon.
but they are in a special position, like firefighters. I suppose train drivers. No. Maybe you can't have a society without train drivers at the moment. Anyway.
Excuse me. What it is the fact that they're dealing with a human body,
exactly.
And they've got everybody to ransom. The money where it should be spent are the HCAs. They need the money, not the doctors.
Healthcare assistants. Okay, thank you. Right. That's interesting. Thank you. Peter in Wolverhampton, hello.
Morning.
You support them?
Up the workers.
Up the workers?
Yeah.
And you see doctors as part of that?
Oh, absolutely. I support all strikes anyway, but I think that particularly after what they did for us in COVID, these guys deserve about 40%, not about 30%.
Well, yeah, that was a hard time. I mean, I've seen people say that that's what the NHS is there for, so you don't necessarily do anything exceptional when you are working inside hospitals to help people who are ill. That's what it's there for, Peter.
Yeah, no, but, workers are on very low wages, and we all need a pay rise, and so do the unemployed and the disabled and the underclass, and we need to get this money off these international capitalists and give it back to the country.
Is there enough money to do that, do you think?
Well, they're just investing $7 trillion in AI internationally.
Okay, well, we're back with that. There's another. So either get it off the boats or get it off the billionaires, Kevin. Yeah,
well, I'd rather go with the billionaires. I like the boats to stop too, but I don't want to demonise and scaremonger just about people coming over here for a new and better life. But Peter's onto something about there is the huge inequality in Britain.
Yeah. You know what? That is the big thing. People who are smarter, much smarter than me, say the big change in the last 30 years is we have a super rich level now. and the ordinary person on an ordinary wage cannot now see any way of joining it. And it used to be you had someone in your town who was very well off, and you thought, if I work really hard, I can be as well off as her or him.
Yep.
That's gone. And it's true, there's a sort of pollution element here, isn't there, by wealth.
Well, the gap has got massive.
But does the gap
Rich and
matter?
poor.
Yeah.
Well, I think it does. I really do think it does.
Yeah,
And I think,
probably right.
I mean, we're talking, your callers were talking about the whole healthcare system. It's not the nurses, it's not the auxiliaries, it's not the cleaners, it's not the admin workers, it's the junior doctors, the resident doctors that are pushing for this pay increase. No one else.
The doctors are a symptom of something much wider, and that is, in the last Parliament, living standards fell. I think it was the first Parliament they did. Wages have been squeezed for an unprecedented period. They're rising now faster than inflation. I think last 10 months they've risen faster than they have in the previous 10 years. But the base where you are is a lot lower. And I look at a lot of people, they would get a job, and they would know they'd be able to afford a house and have a car and have holidays, and that's broken
That's
now.
my mum and dad.
Yeah,
Exactly.
and doctors are part of that. And look, I'm looking at your easel, your 38,000 foundation year one. You've done 5 years at university training there. Now
That's a good point.
that's around the full-time average.
And you will have a
salary
debt of
cost.
100 grand, probably. Yeah.
So I can see why Wes Streeting, and he's got the purse strings. He's got to make decisions, which are very difficult. And I can see why he's saying no to the junior
there's
doctors
lots
after
of
the
courses
previous
that are
increase.
5 years.
But at the same time, I see why resident doctors are angry, although
If you
fewer
want
of
to
them
be-
are taking part in
That's
what I was
strikes
going
now.
to say.
Yeah, architects are 6 years.
Yes, and they've then got their part ones, their part
And they
twos,
don't earn
and part
anything.
threes, and they earn absolutely nothing.
Yeah.
And they're in charge of building houses.
Yeah.
And,
All right.
and big tight.
Yeah, but they don't. But if you fall over in the street and an architect comes to help you, you're going to die. That's the trouble.
Well, if they had a training, if they worked for a Tesco's.
All right, well, we'll talk about that later. After the break, we're taking more of your calls on whether you back doctors going on a 5-day strike. 020 7862 2222. We'll see you shortly. So here is the question we asked. How do horses react when they eat clover? Do they burp loudly, hiccup or drool excessively? And it is they drool. So we got some pictures of a horse drooling, I'm told. Director Dan says. Oh my goodness, I didn't know it was going to be like that. And we've got later on the man who does the recipes in the Highlands coming in. I don't know why I thought of that.
Drooling, yeah.
He's going to be great. Yeah, he'll make a horse drool. Later we'll be asking if all school children should perform Shakespeare. What about it? We're talking perform, not sit and read. Get up and perform it to the class. And if you're shy, I'm sorry, this is the School of Hard Knocks now.
Tough
You're coming
love.
up. Yeah, tough love. More calls on the doctors' strike. They're set to walk out tomorrow morning for 5 days. Should the government cave in and pay them more money? 020 7862 2222. So we've seen up there, I had that board with the figures on, and they, it's true, if you're on 38 grand as a doctor, leave out the overtime, don't mention the pension, but you would have trouble paying off a debt of £100,000 quickly. Margot in Bedfordshire, do you sympathise?
No, I don't sympathise. I do not think they should strike. I mean, people are ill and hurting and operations get cancelled. And what happened to the Hippocratic Oath? They're breaching it. Do no harm.
It's a tricky one, isn't it? Because we do have strikes with firefighters, don't we? Or have they been?
I thought they were protected.
Well, I don't,
No.
because the army come in. But if you're a firefighter on strike and you drive past a burning house, that's got to be conflicting.
Yeah,
I would
but they
have thought.
don't. They don't. It's rather like there are deals with the doctors through the British Medical Association that if there's a major emergency,
Nah, but
they
that's
will go back to work.
But people die
But why?
despite that.
But Jeremy, these strikes are in England. They're not in Wales and Scotland and Northern Ireland, other parts of the United Kingdom. So why?
Because the Scots have paid more. They paid the doctors more. Yeah.
Well, there we are. There's
Where's
an
the
answer.
money come from?
Westminster for the Scots, don't get me started in the Barnett equation. But anyway, because
is the
that's
way of
part
getting a
devolved
special-
government. Yeah, exactly.
Yeah, but it is only
Call it
England.
that.
It's only England.
Okay, interesting. Margot, thanks so much. Zora in London, are you affected by the doctor's strike next week? Hey, Zora.
Personally, no. But can you hear me?
Really well, actually, yeah.
Yeah, okay. The best kept secret about doctors is that they pay huge amounts to the Medical Defence Union and the Medical Protection Society. These are compulsory from the time either doctors or dentists write a prescription right from when they're very young, and goes on all through their working life. And it can be up to half, you won't believe it, but it's true,
Half
the
their
Medical
pay?
Defence Union, up to half their salary. It could be.
Yes,
And
I've
it's not
heard that it's a lot.
reimbursed.
I don't believe you'd be paying 15,000 a year for that. I really, really don't. But maybe I'll be
Oh, yes.
corrected. 15,000
Oh,
pounds
yes.
a year.
Oh, yes, yes. You don't know. It's a best kept secret. I mean, I know a doctor who was earning 600 take-home pay 600 years ago, and of that they paid 400 to the Medical Defence Union. These are best kept secrets.
Is it? Can I
Another
ask,
thing about...
was he paid? Did you say he was earning
Can I-
600? No, you can't. Sorry, because I'm asking you a question. Did you say he was paid £600,000?
No, he was paid £600 a month.
Oh, right. Okay.
This is some time ago, and he had to pay £400 compulsorily.
Well, we haven't thought of that. Yeah, I thought the NHS would cover
Yeah,
that.
can I continue, please? Please. The other thing is they have very long shifts, resident doctors, very long. So they are given a small room to rest in sometimes, but they cannot
Very small.
commute. Hello.
Yeah,
If they're hello.
Keep going, Zora.
If they are doing a 14-hour shift, or if they're doing 12-hour, they can't be bothered to claim overtime. There's no time. They want to eat. They want to sleep. They cannot do long commutes. So they have to have a place to put their things, their shoes, their books, their clothes. Their
Okay, Zora.
They have to have a place to put it.
Okay.
And the third thing
the third thing, yeah.
is more. The responsibility is more than anybody else in England.
Well,
if somebody dies,
what about a crane operator?
If somebody is dying,
Yeah.
and there's nothing more important than human life. There's nothing more important.
What about
than human
but
life.
hang on. What about someone who drives a school bus?
Yes, and if somebody is dying at the end, who do you want?
I always
You
see these
want
buses
one
and they.
doctor.
Okay, thank you, Zora. I do see these buses and they got 18 kids in the back, and I'm thinking the responsibility on the driver.
A lot of people have responsibility.
Yeah, for sure.
Unquestionably, bus
We don't.
drivers, crane drivers, pilots. The electrician who come and does your house. If they do it wrongly, you could have a disaster.
Yeah.
In fairness to Wes Streeting, to taking up the point on fees.
It's interesting what she said there.
Yeah, but he's offered to pay their exam fees and also their membership of the Royal Colleges, the Royal College of GPs.
Which is an employer, they should do.
Yeah, but it also means
I
they
thought
have
he was
to
saying
pay
he
now.
would pay off their student debt at one point. That's a massive one.
Yeah, I think that was floated, but it was because it is massive. It was never followed
All right,
through.
listen, Zora, thank you. Thanks for calling. Please call again. Rebecca in Essex, hi.
Hello.
Hey, sorry, we were kind of snagged up on the last call, not without good reason. What would you like to say?
That was interesting. I don't agree with them striking at all. I think they sign a Hippocratic oath, and I think they should stand by that. Police can't strike. They have a duty of call in a respect, duty of care, that they should be looking after people. Everybody is going to be put back on the list for the operations. I agree with what Claire was saying. People have been waiting so long. They get enough money for what they do. They are still learning. And let's face it, when they sign up for these roles, they know exactly what's what.
Okay, all right. I just want to try and take one more call. Thank you so much, Rebecca. Robert's in Devon. Where are you in Devon, Robert?
I'm down by the Riviera, sir. So,
nice.
yeah.
What do you want to say?
I'm a nurse. I do not agree with the strikes at all, but there's a big but. If you want better standards of care, if you want to have waiting times reduced, and you want the doctors not to go, and nurses, you don't want them to go to Australia, New Zealand, etc., then you've got to pay them. And I don't agree with that, but loads of my friends have left. About 90% of my friends have gone.
Okay.
And the reality is, when these strikes go on, when you're working in the emergency departments, the people think before they come, they think, Do I need to be there?
We've got to go to our break, but Robert, thank you so much. Thank you for all your calls on that. Later, we'll be asking if all school children should perform Shakespeare. After the break, should the government allow Shamima Begum to return to Britain?